Here's an example of the nonsense of functional medicine. Hi, I'm internal med doc, a board certified internal medicine physician. I want to share a story with you about one of my patients that has been struggling with type 2 diabetes. I've been taking care of this person for a few years, and like any patient, you go through the ups and downs of managing your chronic disease. Sometimes the type 2 diabetes is doing well when this person was following the diet, the exercise, taking the medicines. When their diet slips or their lifestyle slips, the diabetes gets worse. And you kind of go through this ups and downs, right? And so I was seeing this person in follow-up after one of the ups, actually one of the downs when she was doing a little bit worse. She came back a few months later and kind of frustrated overall with the whole situation. And then she drops this huge stack of papers, on my desk, and he's like, I got tired of Band-Aids for my type 2 diabetes, so I went to a functional medicine doctor. And they ran a bunch of tests checking for toxins and moles and this and that. And then she proceeds to tell me that they gave her an anti-parasitic that she took for like 2 months because she saw some stuff in her stool. And then lo and behold, she lost 10 pounds. Diabetes was doing better. She was feeling a little bit better. She was still taking the medicines I prescribed her. She didn't stop all those, but overall things were better, and she's like, there, I'm better, and thanks to this functional medicine doctor. And I kind of laughed and chuckled a little bit. First of all, I told her that no, you didn't have parasites. That's nonsense. So you took anti-parasitics for 2 months for no reasons. Then I kind of asked her, like, so since seeing this functional medicine doctor, tell me, what are you doing with your diet? Well, she's like, well, I'm eating smaller portions. I cut out all the sugary stuff that they told me to. I'm also eating less of those, refined starches, trying to increase my fiber, so I'm eating better. And so I'm doing that as well. And I kind of laughed a little bit in the inside. Then I also asked this person, how much did you pay for this huge stack of papers and labs? She said too much. She wouldn't tell me how much she paid for. And so that clearly highlights kind of, the nonsense of this whole field of functional medicine. I basically told her, first of all, you don't have parasites there. I already mentioned that. And I was like, you know what? Give yourself credit, because this functional medicine doctor did nothing. You ate better. You said you're eating smaller portions. You did a lot of the lifestyle changes that we've always talked about for the last 2 or 3 years. And we have a track record. When you follow those things, your numbers get better, your weight goes down. So it is you. You did that. You improved your lifestyle. Don't give credit to the functional medicine doctor for the nonsense and this anti-parasitic stuff, all this toxin mold stuff that they checked. That didn't do anything. You did the hard work. You lost the 10 pounds. You improved